Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso Menominee hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your host, Gary Dodge.
And Sheeta Mapus. As usual, we are joined by Vaughn Bowles on this episode, the Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind people very quickly before we start that you can send in your COVID-19 related questions to us at podcast@mitw.org. So this week, we're going to do something a little bit different. We're going to be going over some different scenarios that patients or community members may have as far as symptoms and things and how that would play out. So Gary and I are going to be patients and Vaughn is going to be our healthcare provider. So
thank you for calling the Menominee Tribal Clinic. This is Nurse Vaughn. How can I help you?
Hello, Vaughn. This is Gary. I was calling. I have some symptoms.
All right, Gary, what are your symptoms? Do you currently have a fever?
Yes. I'm burning up.
Are you having any difficulty breathing or a cough?
Been short of breath.
Have you lost your sense of taste or smell as well?
Yes.
Okay. Well, let's talk about this a little bit more. Have you had severe shortness of breath? Can you walk across the room?
I can barely get up from the couch.
Okay. Have you coughed up more than a teaspoon of blood at all or anything along those lines?
Yes.
Okay. Are you feeling any severe chest pains or pressure on your chest whenever you cough?
It's like constant pressure.
Constant pressure. Okay. Are you able to keep liquids down?
No.
Are you feeling dizzy or dehydrated?
All the time.
Have you been confused at all or less responsive than normal when people talk to you?
Yes, I've been confused a lot lately.
All right, Gary, our recommendations at this point is that you seek immediate emergency care. Once you're off the phone with me, I want you to call 911, okay?
Okay.
All right, repeat back to me. What are you supposed to do after this call?
What was that again?
Gary, after this call, I need you to hang up the phone and I need you to call 911 and seek medical attention at an emergency hospital, okay?
Okay.
All right. Thank you, Gary. Good luck.
Bye.
Click. We'd hang up the phone at this point, and Gary would hopefully call 911 and be emergency transported to an emergency room. If Gary hadn't had symptoms like, the shortness of breath, coughing up blood, hopefully no one's had, coughing up blood at this point, we'd talk about some of the other symptoms just to see if he was at risk for a COVID exposure. We'd definitely ask, if he was over the age of 85 or if he was had any chronic lung diseases like asthma or COPD. We'd check for chronic kidney or liver issues, high blood pressure, heart disease, diabetes. Also, if Gary had what's considered extreme obesity or a BMI over 40, he'd be more at risk, or if he was a person that was immunocompromised anyways, cancer patients, a transplant recipient, things like that. If he was pregnant, that would also put him at slightly higher risk. Kind of doubtful since Gary probably won't be pregnant anytime soon, I would think. And if Gary had had a fever for more than 3 days, then he'd be into the moderate symptoms. And we'd want to schedule an appointment to make sure we were keeping track of his respiratory symptoms. We'd probably bring him in for testing eventually as well. Thank you for calling the Menominee Tribal Clinic. How can I help you?
Hi, I'm experiencing some COVID symptoms.
Are you experiencing a fever?
No, I'm not.
Have you had difficulty breathing or have been short of breath?
No.
Have you had a sudden loss of taste or smell?
No.
Or a cough at this time?
No, I don't.
Have you experiencing Any other symptoms, including muscle ache or fatigue?
Yes.
Are you experiencing nausea, vomiting, or diarrhea?
Vomiting.
Vomiting. Okay. Do you have a sore throat?
Yes, I do.
What about runny nose and congestion?
Yes, I do.
Have you experienced a headache?
Yes.
All right. So, Sheena, are you a healthcare worker, critical infrastructure worker, or a teacher?
No, I'm not.
Okay. Have you been exposed to COVID-19 in the past 14 days or are attending school in person?
Yes, I am.
All right. Well, it sounds like you have mild symptoms. What we'll have you do is we'll have you go to our transit facility for a carside COVID test. We will swab your nose, send that culture out, and we'll get the test back soon. We'll have you monitor your symptoms at home, including your hydration. If you are not living alone, we'll have you self-isolate in a portion of your home away from the rest of your family to decrease the likelihood of their exposure. And we'll have you isolating for at least 14 days, and we'll get back to you with that test to see if you are positive or negative for COVID-19. Does that sound like a plan?
Sounds like a good plan to me.
All right. So with Sheena's case, she didn't have the typical symptoms: fever, difficulty breathing, cough, sudden loss of smell or taste. But, just because you don't experience those things doesn't mean you don't have COVID-19. The runny nose, congestion, headaches, also very common with COVID-19. Same with the sore throat, nausea and vomiting, things like that. If Sheena had said yes, that she was either a healthcare worker, critical infrastructure worker, or a teacher, we would have just almost immediately had her go in for testing, and then also notify her employer regarding, or have her notify her employer regarding whether she was exposed to COVID or not. And we'd start contact tracing on both patients, Gary and Sheena, regardless of where they were tested and what happened next. So we hope this has cleared mud for everyone. And, if you are experiencing symptoms, please just call ahead to the clinic. Let us know how you're feeling, what symptoms you're experiencing. We recommend keeping a journal of onset of symptoms. Keep track of your symptoms. That really helps healthcare providers sort out how best to serve you and make sure you can overcome any sort of illness you're experiencing, whether it's COVID or the common flu, and we are coming into flu season, so that's something to keep in mind as well. Little caveat: if you're a low risk patient, someone that's under the age of 65 and fairly healthy, and you have mild symptoms and no known COVID exposure, that doesn't mean you don't have COVID-19. Right now in the community, we're having a lot of community spread cases. These are ones where people don't know if they're around people that have COVID. They may be asymptomatic at the time. So just because you don't know if you've been around someone with COVID, it doesn't mean you don't have it. So contact your healthcare provider, tell them your symptoms, and go in for testing if possible, or if they ask you to. We don't have any other questions this week, but we would like to put out a reminder that, the community spread of COVID-19 is still high in our community, one of the highest counties in the state. These spreading, the virus has been spreading via small group gatherings and ride sharing. And so we know the holidays are coming up, and we want everyone to stay healthy through that time. So please act accordingly. Remember to wear a mask, wash your hands, try to avoid large group gatherings, and stay healthy during this holiday season.
Thank you, Vaughn.
Thanks for your acting skills and abilities, guys. Thanks for helping me out with this.
I'm sure I blew everyone away.
No, absolutely.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the community tab, and keep up to date by following us on Facebook at MITW Podcast. And we do weekly updates with Vaughn. We welcome any community questions you have regarding COVID-19. Please send those in to us via email at podcast@mitw.org.